While the Ministry of Health still has an arrangement with the Caribbean Public Health Agency in Trinidad and Tobago for 10 samples to be sent on a monthly basis to be tested for new COVID-19 variants, the Icahn School of Medicine in New York has been secured as a second partner to conduct gene sequencing on local samples. As such, on Wednesday, Minister of Health Dr. Frank Anthony, during a daily COVID-19 update, disclosed that 180 samples will soon be sent to the New York School of Medicine. The arrangement was facilitated by Berg, a medical company between the Ministry of Health, Mount Sinai Hospital, and the Icahn School of Medicine. He explained that the samples will be collected from persons in regions bordering neighboring Brazil.
Because we know Brazil has the P1 variant, people who might be coming across from the border, we want to know whether or not there's any indication of the variant coming into Guyana, so we have to go closer to those areas to try to detect. And so samples coming out from those areas, we'll be sending them for sequencing.
Brazil is at a crossroads in its fight against the coronavirus and its variants. The nation is still grappling with record-breaking death tolls and a healthcare system on the brink of collapse. Some of the precautionary measures taken by local health authorities to keep the virus at bay include the closure of the land border and the recent suspension of flights to Brazil. To date, the P1 variant has been confirmed in Brazil, and it is said to be highly transmissible among humans. In January of this year, 10 patient samples were sent to CARFA to be assessed for new COVID-19 variants following a disclosure by the Eureka Medical Laboratory that there were suspected cases floating around the country. CARFA's results dispelled claims of any potentially existing variants. Minister Anthony added that the results from these tests will clarify whether there have been instances of COVID-19 reinfections locally.
We wanted to know whether someone was infected with, let's say, a variant earlier in the pandemic, and now they got reinfected with a new variant. And if that is the case, what are the differences, and to better try to understand that.
Temika Rodney reporting for the HGP Nightly News.